The United States Agency for International Development (USAID) funded Momentum Safe Surgery in Family Planning and Obstetrics in collaboration with Bauchi State Government through the State Hospital Management Board have commenced a 2-day training of health workers on standard operating protocol for core interdisciplinary surgical terms. Declaring the training open, Executive Chairman Bauchi State Hospital Management Board, Dr. Mohammed Sambo, said the training is aimed at giving skills to the frontline health workers to be able to manage maternal cases and also to reduce cases of VVF, which is on the increase as a result of lack of adequate knowledge. Our correspondent in Bauchi State, Awan Hassan, completes the story. Take a look.
The Executive Chairman Bauchi State Hospital Management Board, Dr. Muhammad Sambo, while declaring open the 2-day training for frontline health workers, says the training is part of an effort to improve on deliverables, especially maternal health regarding issue of vesicovaginal fistula (VVF) in Bauchi State.
And this training, is a training to give our, especially doctors, midwives, who are the frontline health workers, the skill to be able to manage, maternal cases and ultimately reduce cases of VVF that is normally as a result of lack of the knowledge.
Dr. Sambo says lack of awareness creation on vesicovaginal fistula has been a major factor that contributed to poor knowledge of the ailment. However, with recent awareness creation and enlightenment campaign, more cases continue to emerge.
So once a woman gives birth, the community shouldn't come to facilitate any of the hospitals, either primary or secondary. It means we don't have the record. And she'll be there and people will start taking it to be, a different issue. But recently with the increase in awareness in our community, we are beginning to see more cases of this. That doesn't mean that number of cases are increasing, but awareness has increased. Definitely, you begin to see more people coming into facility.
Earlier in his remark, Malam Rabiu Abdulhab, Fistula Desk Officer Hospital Management Board, Bauchi, said the idea behind the training is to equip the healthcare service providers with the knowledge to be able to manage obstetric fistula at various secondary facilities within the state.
Actually, when you look at the settings of our healthcare personnel, so they need a training on this obstetric fistula so that we are going to managing the obstetric fistula at our secondary healthcare facilities in the state so that it will reduce the high volume at the National Obstetric Center Ningi, which is they are receiving the high volume of cases of fistula. So when we do it at the state secondary facilities, it will go a long way to reduce the high volume, the number.
More than 50 participants are drawn from the secondary healthcare facilities in the state and are expected to step down the training. Awal Hassan, Viewer TV News, Bauchi.